Hello everyone. Today we are going to have a discussion on dental trauma, that is intrusive luxation in mature and immature permanent teeth. The immature permanent teeth are whose root formation has not been completed yet. When the permanent tooth erupts into the oral cavity, it takes 3 or more years for the root formation to be completed. In the intrusive luxation, there is displacement of tooth in an apical direction into the alveolar bone. The tooth will appear shorter. The clinical features will show that the tooth is displaced axially into the alveolar bone, and as it is intruded, it will be immobile. The percussion test will give a high metallic sound, and it is a possibility that when you do a cold test, it will give no response. The radiographic assessment and finding. The periodontal ligament space may not be visible for all part of the tooth, especially axially. And the cemento-enamel junction is located more apically in a intruded tooth than the adjacent non-injured tooth. Here, this is a non-injured tooth. Its cemento-enamel junction lies here, while the cemento-enamel junction of intruded teeth lies below. You have to take one parallel periapical radiograph and an occlusal radiograph. The two additional radiographs of the tooth taken with different vertical or horizontal angulations. The radiographs which are recommended are one parallel periapical radiograph. The two additional radiographs of the tooth are to be taken with different vertical or horizontal angulations, and an occlusal radiograph. The management of teeth differs for immature and mature permanent teeth. There are three options. One is spontaneous repositioning, another is orthodontic repositioning, and the third is surgical repositioning. Now let's discuss in case of immature teeth. In the immature teeth, you have to allow re-eruption without intervention, which means spontaneous repositioning, independent of the degree of intrusion. Then wait for 4 weeks. If there is no re-eruption, then you have to initiate orthodontic repositioning. And in between, you have to monitor the pulp condition, because it is noted that the pulp become necrotic and infected, or that there are signs of inflammatory external resorption at follow-up appointments. In this case, you have to initiate root canal treatment as soon as possible when the position of the tooth allows. The endodontic procedure suitable for immature teeth should be used. In case of mature teeth, if the tooth is intruded 3 mm, then allow spontaneous re-eruption. Wait for 8 weeks, and if there is no re-eruption of the tooth, then you have to reposition surgically and splint it for 4 weeks with a passive and flexible splint. Alternatively, you can reposition orthodontically before ankylosis develop. But in case if the tooth is intruded 3 to 7 mm, then preferably you have to reposition it surgically or orthodontically. But if the tooth is intruded beyond 7 mm, then repositioning surgically is the best option here. It is a possibility that the tooth with complete root formation almost always becomes necrotic, while the teeth with immature root have a possibility of spontaneous re-eruption, and they might not get necrotic. The root canal treatment should be started at 2 weeks or as soon as the position of the tooth allows, using a corticosteroid, antibiotic, or calcium hydroxide as an intracanal medicament. The purpose of this treatment is to prevent the development of inflammatory external resorption. The follow-up visits are at 2 weeks, 4 week, 8 week, 12 weeks, 6 months, then 1 year, and after that yearly for at least 5 years. The favorable outcome are the tooth will be asymptomatic, it will start re-erupting, the lamina dura will be intact, pulp sensibility testing will show positive response. However, it is noted that a false negative response is possible for several months. Endodontic treatment should not be started solely on the basis that the tooth is not responding to pulp sensibility testing. No signs of root resorption. The continued root development in immature teeth are a good and favorable sign. The unfavorable outcome is, so in intruded teeth, mostly the unfavorable outcome is the external inflammatory resorption. If this type of resorption develop, root canal treatment should be initiated immediately and a corticosteroid antibiotic medicament can be used initially, which is followed by calcium hydroxide. Thank you everyone.